All right, well, it's nice to see you all here and a few of my old patients as well, so it's thank you for coming. You know, it's great to live in this time and age when we have the power to change things about us that we don't like. And if we go back to Cleopatra and probably even before then, people were doing cosmetic surgery then, and you know, she had radiant skin because she was apparently bathing in milk. And of course that was fermented milk, which creates lactic acid, which is what we call a beta glycolic peel today. So there you go, you know, thousands of years ago, that's what people were doing. Tonight I'm going to talk about liposuction and a little bit about how it works, show you lots of before and after photos, and feel free to ask questions and interrupt at any time. It's a free discussion. If you've got any difficult questions, I reserve the right to phone a friend, or maybe even ask the audience. As you may know, I've been doing cosmetic surgery for, next year it'll be 30 years, so it's pretty scary. And I started liposuction in the days before it was the modern technique called tumescent liposuction. So in the olden days, we would put the patient to sleep with a general anaesthetic, put a tourniquet on the arm or the leg or whatever we were doing, and just dry the blood out that way and do what we did. And then after a while, release the tourniquet and you get a huge amount of bleeding and bruising, and you'd often have to transfuse the patient. And just about a year or two after I started, we introduced what's called the tumescent technique. And the tumescent technique means that you fill the tissues with a special anaesthetic fluid, and that numbs it and constricts the blood vessels. And that was a real breakthrough, because now we don't transfuse at all. And sometimes, you know, it's just like, you know, you really don't see any bleeding. So that was a big advance. And people are still arguing as to who invented it. You know, was it Pierre from France, or, you know, doctor from Southern California? But the bottom line is it's now well understood. So, as you may know, I do all cosmetic surgery except for rhinoplasties, and I've even been trained to do rhinoplasties. So I think I've even got the small one booked in a few weeks. But as a rule, I don't do rhinoplasties, but pretty much everything else. And liposuction is great because it really improves the contour, it permanently removes fat, and it's a long-term change to the body. Now, when we read about liposuction, we hear about a few different terms. What is the difference between liposculpture, liposuction, and I've even trademarked something called liposlender? The answer is really not much. It's the skill of the doctor that gives the result. And I like to think of people as being in 3D. So rather than just treat one area, usually it's something that I sort of say, well, look, if we take this down, something else might be apparently bigger. So to me, that's liposculpture. And sometimes we even shift fat from one part of the body to another. So we are often doing that to the breasts or to the face. And a couple of weeks ago, I did a fat transfer from the knees to the outer buttock here on someone who's changing sex and going to the other side and wanted a more rounded bottom. And that works quite well. Ultrasonic liposuction is advanced technology that we do use, and that is really great for small areas because, and I'll show you later, some amazing photographs of skin tightening, but it's not really good for large areas. External liposuction was a fad a few years ago where people thought if you rubbed like a really strong physio ultrasound machine on the skin before doing the procedure, you'd get a much better result. But actually that's been shown to be bullshit. But a lot of people spend a lot of money on that, and it was all rubbish. Nowadays, of course, we have these things like Zeltic or cryo treatments to melt fat away. And that's still, I think, it's promising technology, It's good for small areas. I've seen reasonable results. I've never seen a brilliant result, and I've seen quite a few problems where it's uneven and all that sort of stuff. So I think it's still a year or two away from being really good. Laser liposuction is, once again, really good for small areas. It's a little fibre that you energise, and we did trials years ago when it first came out, and we did one thigh with laser and one thigh with the normal, and the normal one always came out better. And radio frequency is something that's come and gone, and that was a really smart idea where the liposuction cannula was insulated and there was energy put through it, and the idea was that not only would you remove the fat, but you'd shrink the skin with it. And a few doctors here on the Gold Coast bought it, but it was once again one of those good ideas, but didn't really work. So what do we want from liposuction? Well, we want quick healing, great results, no pain, no scars, no complications, and no cost. Well, we're coming close to some of those. Quick healing, well, nowadays my protocols have changed because a few months ago I invented a new tweak to the tumescent fluid. And now I incorporate directly into the fluid some drugs that very occasionally, let's say with hip replacements and things like that, are given intravenously. But I did all the research and it's quite safe to give it into the actual tissues. So I put something into my tumescent fluid which is anti-bruising and anti-inflammatory. And that means that my patients recover really quickly. And so my protocol for recovery is 3 weeks with the garment, not 6. I take it off here and there as you need, and also no restrictions on activity. So give it a day or two to recover from surgery, and you can do whatever you like as long as you've got the garment on, okay? So that's a big difference to other doctors. The results, well, I don't take on a case unless I think we can get good results. Every now and then, depending on skin elasticity, we might have to do the procedure in stages. And I've got a picture on here, amazing, of someone I did 3 times. We knew it was going to be 3 times, but the result is worth it. Normally the pain is minimal, and the scars are tiny little entry points, normally about 3 millimeters in size, and when they heal, they look like a white freckle. It's nothing major. Complications, when you go ahead with any surgery, there's a checklist of about 20 items that you sign up to, but the reality is that complications are very, very rare, serious complications. And in nearly 30 years of practice, I've had 2 patients that were overnight after surgery unexpectedly. So that's like about 2 out of over 5,000. And one of them was because she developed the larynx tightened up. That was an anaesthetic issue, so she had to overnight in hospital. And we ended up completing the surgery 2 weeks later. And the other one was a lady that, as a precaution, we put her in because we actually took out more than we planned to. And so just to make sure her blood pressure was okay, we put her in hospital. So when we do the procedure, we really try and empty out the area as much as we can to get the right contour. We never try and remove all the fat because then you can get skin straight on muscle and that will create unevenness. You need a certain amount of fat there. And if, when I'm doing the procedure, I feel the skin give way on me, it means it's lost its elasticity. And if we go any further, we'll end up with unevenness. So at that point, we stop, let the body recover, and then if necessary, go ahead on a later date. So we can take out up to 5 litres, which translates to a loss of about 5 kilos. And I have gone up to 15, where we know that we're going to put the patient in hospital afterwards. And usually that is either morbid obesity that we want to just get a quick boost, or someone with a disease like rheumatoid arthritis, where and I've done one girl, I'm not sure if the pictures are on here, but we took off 10 litres, and she went from 100 kilos down to 90, and that took the pressure off her knees. So that made a big difference. But normally, 5 litres for cosmetic things is enough. But you know what? A lot of times, just doing that procedure springs people into an exercise program, and they turn the corner in terms of motivation and all that sort of stuff. And also, if you are suffering from diabetes or blood pressure, it can make a big difference to that as well. So in the olden days, what we used were big cannulas, you know, and we're talking 8 millimetres, 7 millimetres, 5 millimetres. And we even had big, long things that we had to put together in pieces because no sterilizer was big enough. But we used to liposuction, like up here from the groin. So we'd hide the scar in the groin, go all the way up through the body just to liposuction these, like, you know, little wings up here. And it worked. But now we are using much finer instruments. And we even have ones smaller than 1.8 millimetres. And that's great for doing very superficial work, you know, on the face, like for jowls and necks and things like that. We have a variety of different openings and different ways of removing it. But this is what we like to see at the end of a procedure. We start off with what's on the left and we finish up straight away with what's on the right. And that still is swollen. So normally you'll see half the result straight away, but the final result can take sometimes 2 or 3 months to come through. And there's another. So this is using the ultrasonic liposuction. And here's a lady in her roughly around 40. She's actually got MS, so her immune system's not that great. And that's the result. And you will not see a scar on her, all right? So she's had no threads, no lifting, just the ultrasonic liposuction. And here's another one. We did this girl last year. She had a special occasion, one of her daughters getting married, and she couldn't afford, you know, surgery. And I said, well, look, let's give it a go. And great result. And here's another one. Another one. And in men, of course, we can really contour the jawline. Now, this gentleman went on to have an implant in the angle of his jaw. Now, I don't do that, so I sent him somewhere else, but we converted him into one of those typical American, you know, superhero type, square jaw type of things. Now, this is combining the liposuction with some threads. So we have a technique called the trampoline lift, which is something from Dr. Mueller in California and Los Angeles. I spent a week with him a few years ago. And basically we shoelace some special threads that he's invented up through the tissues there, permanent lift, and it really gives a nice definition to there. It takes a few weeks to settle down afterwards. And this is another example of the threads with the ultrasonic liposuction. Pure ultrasonic, and here we are, combination of ultrasonic with my very fine cannulas, just making a huge difference to that person. And no scar. You will not find a scar on her. And this guy flew in from Sydney, and that picture was taken less than 24 hours before he caught his plane back to Sydney. And, you know, this is thing like minimal bruising. Yeah. That's right. Yep. So that's, now there has been something released by Allergan, the makers of Botox, and it's called Belkyra. Has anyone heard of that?
Is that the injection?
The injections.
My girlfriend had that.
Yeah. Okay, so there is an injection technique available where you have normally three sessions. They can be extremely painful, followed by weeks of swelling. It does work. I'm quite surprised that Allergan paid $1 billion for the company that released this Belkyra product, because we've been formulating the same thing with the compounding chemist for years, and at a much lower cost, I can tell you. It does work. It's not for everybody. I still prefer the surgical procedure because I know that it works, and we do get a better result than the injections. And the cost is similar, and with the surgery it's like 1 week of wearing a garment and you're over and done with, but with the injection it's like 3 times. It kills the fat cells, basically, yeah. And you've got to do it with a special grid, so it's all marked out scientifically because each injection only spreads a certain distance, you know, yeah. Only good for small areas, yeah. Now, with the arms, as long as the skin elasticity is reasonable, we can get some great results. And it's much better in the right patient to do this procedure and even repeat it than it is to do surgery, like an arm lift, because arm lift scars never heal well. So even if you have to do this twice, it's definitely a big...
This is ultrasonic or this is...
Sometimes I use ultrasonic, sometimes normal, sometimes a combo. Okay. And this was a 360 degree on an arm. Like, it's like I treated it like a thigh. And she's like a pensioner in her 60s. And sometimes we do like massaging and other treatments on there to get the best possible result.
How did you get to smooth?
Well, it's good technique. Yeah. You know I'm smooth. Sorry. Okay. Yeah, that's the other side. So one of the potential complications of liposuction where the skin elasticity is not good is a bit of unevenness. And so it's very uncommon for me to do a revision, but probably 1 patient in 100 needs a little adjustment afterwards. And this lady's in her 60s. Now, believe it or not, we can even do liposuction on breasts. It will lift the nipple a little bit, and I've got a new technique that will even lift it a bit more. But I wouldn't say it's the best thing for shape. It is really just to debulk a breast, normally in a woman over the age of 50, where there's more fatty tissue in the breast. So you can see with this girl, she's had tummy lipo and actually arm lipo, and we've done the breasts, and you can see, does the laser work on this? Yeah, it doesn't show up on the screen now. That the breasts have got actually a better shape and have lifted a little bit. But she was an interesting patient because when she first came, well, on her review, she said to me, you know, Simon, when I first came to see you, I was a whale, but now I'm a dolphin. Okay. And this is an older lady in her 70s that didn't want surgery or scars, and we just kind of took her down a couple of cup sizes just with lipo. But of course, man boobs are a great thing for liposuction, assuming that the man has not got glandular tissue behind the nipples. So we always test for that first, and if they've got glandular tissue, we need to excise that. And so we can do it all at the same time. But this is typical just fatty tissue. Could be hormonal imbalance, could be from puberty. There's a number of different causes. And often we do it together with the tummy. Now, this is one of my old secretaries, and you get to know your staff well sometimes. Yeah, so I mean, she's like in her early, I think she was 23 or 24, but can you imagine, that's a lifelong improvement, a lifelong improvement.
Sorry to ask you again, but can you just go back?
Yeah.
That's cellulite.
Yes. Now,
Can you get rid of cellulite? I didn't realise it was possible to get rid of it.
you can. Now, 90% of the time I can improve cellulite. And the way that we do it is 2 ways. Number one, just by decompressing the area, so taking the tension off the skin. That's number one. But where the cellulite is bad, then we have a special cannula that is actually doesn't withdraw fat, but it's got like a little sharp fork on the end of it, like a lizard's tongue, and we go through and break up all the little ligaments that are holding the skin down and break it up. And we get the improvement that way. If you want an even better result, after that sort of treatment, you do some aggressive lymphatic massaging, because you don't want those fibrous connections to reform. So you've got to milk the fluid out and just move the tissues around. Endomology is a good technique for doing that.
You still know that girl? You got a number?
Speak to me later. So this is a 360 degree on a thigh. So, you know, I know all of my colleagues, they'll charge outer thigh, inner thigh, knees, front of thigh, you know, back of thigh, all these different areas. I say, no, bugger it. You're in 3D, we'll treat you in 3D. So we just do whatever's required to slenderize the thighs, and that's why I trademarked LipoSlender, because that's what we do. And sometimes you do need to repeat it. So this girl had one session. She's got a little gap between the thighs now. Would she benefit from a second go? Yeah, she'd get a little bit more out. Did she ever bother to do it? No. Same with this. One session. There's a little bit left. Could we do another session? The answer is yes, but not needed. This shows the improvement in cellulite. It's quite dramatic. And this is the sort of person that represents a real challenge, because there's kind of no muscle to give shape. But nonetheless, we did get a great result. Now this is Tiana, and she's my patient that I did 3 times. And when we started off, she was a clown at kids' parties. She was like a kids' entertainer. And now she's a personal trainer. So, you know, and she had a total body makeover. We did liposuction on her tummy, her arms. We did breast surgery and all that sort of stuff. And, you know, I think in those days, I can't remember what it cost, but it would have been a fair amount. But, you know, she's got this body for life.
So you say for life,
Yeah.
she could overeat and get bigger again, or did you kill the fat cells and they won't grow?
They're not there. They're actually removed. So when you put on weight, your existing fat cells expand one by one, and then they shrink when you lose weight, but they're always still there. Once you physically remove them, they're gone. So then the question is, if you still overeat, what's going to happen? And in theory, like the fat cells here have got their own DNA programming, which is different to the fat cells there. Then you've got other things like brown fat cells, which are metabolically different to white fat cells and all that sort of stuff. I don't think I have ever seen someone become imbalanced after liposuction from putting on weight. And I have had a few patients come back at me because they put weight on after liposuction, and one girl's tried to blame it on the hormonal changes from liposuction. That's why she put on weight. No, darling. And then I had a Lebanese guy a few years ago that I took down from 100 kilos to 96. We took out 4 litres of fat, and then he was so happy. He bought Lebanese pastries for us and everything else. And he comes back about 6 months later. Oh, I'm not happy. They're still fat. I said, yeah, there is. We might have to do something about that. Let's hop on the scales. And he was 104 kilos. All right. So he's actually 8 kilos above what he should be. All right. Complained to the medical board about me. I said to him, come back when you reach your pre-op weight at least. Yeah. And, you know, like then we can talk. Anyway. Now we often have triathletes that are just obsessed with those little curves, you know, like God bless them. And so they represent a real challenge, because you have to do very, very fine work, and they're so critical on themselves and their body that, you know, you make the slightest little mistake and, you know, you're in trouble. But we do them. And here you can see the inner thigh and slight, you know, curve improvement on the outer thigh. And this just shows the marking that we do before the procedure. So when you're there wearing your G's and in all your glory, we mark you up. It's like a weather map with the high pressure points and the low pressure points. So we mark out where we have to concentrate on, and sometimes I'll use a red texter where we have to avoid, because a lot of us have got little dents that are there anyway, and we don't want to make them worse, so we mark them in red. But normally you can see the improvement in 2 weeks, and that's the back view. We can do the pubic area, and it's surprising how many ladies that we have to do that to, especially if we're doing tummy tucks, because we can flatten the stomach, but if the pubic area is still big, you know, they don't like it. And we can do the calves and the ankles, and sometimes people have got little fat pockets on the feet or around the knees, then we can take those down as well. And for that we use very, very fine instruments. Tummy, of course, one of the big areas, and with youthfulness comes skin elasticity. It helps us a lot, but even in the older age group we can make a big difference. Of course, doing a few sit-ups helps as well. Where the skin elasticity is good, we can do a very deep sculpting. And where the skin elasticity is not so good, we can't go quite as far, but we still can get a really great result. And you can see how I've corrected the buttock fold in this girl. So we can do that by just skillfully overdoing the skin from underneath where we want to create the new fold. And sometimes I'll actually put some stitches in to kind of encourage that to take place. And sometimes we correct other surgical problems, like this girl, I corrected her umbilical hernia at the same time. I'm not a general surgeon, but I did a lot of training in general surgery, and you know, pretty good at doing all that sort of stuff. Now, humans with Y chromosomes, i.e. men. All right, so typical sort of moderate improvement. If he did his tummy exercises and had a second session, he'd get a great result. But sometimes you're up against genetics. You know, there's 3 types of bodies. There's the ectomorphs, which are tall and a bit of a fatty constitution. And then there's the mesomorphs, which are more like me. I think I'm a mesomorph, more sort of muscular and more of a V shape on the chest. And you're not getting that money back. And then there's the endomorphs that tend to be, you know, like not muscular, big stomachs and things like that. And that's from embryology. So, you know, you look at people walking down the street, you're an ectomorph, you're an endomorph, you're a mesomorph. You're an idiot. Okay. So this guy's always going to be hairy, but we did the love handles. Yeah. And this guy's always going to be a big boy. He's less big. This is a combination of lipo and exercise, and a dramatic change in just, you know, 6 to 8 weeks. Yeah, and get them to colour coordinate it afterwards. And, you know, like this, just total upper body liposuction, but permanent improvement. This is actually a medical student, friend of my son, and we just did liposuction on the breasts. And now this was an interesting guy. So he came to see me, look at the bottom photo, and he's about 40 years old. He wanted improvement. And I said, well, look, you are so, and he's like a big fella. I said, with you, to be safe and get the best result, we have to do a liposuction first. Then when we debulk everything, we can talk about doing a tummy tuck. And you need a full tummy tuck. Well, he came in 2 weeks after the liposuction, and I said to him, shit, you don't need a full tummy tuck. We'll get away with a mini tuck. He had a lot of skin tightening. He said, well, what if we do the liposuction again? I said, okay, we'll repeat the liposuction again. And that's the result. He does not need a tummy tuck at all. Now, I did not expect that, so that was an unexpected bonus. But It just shows the power of the person's healing and good technique. So we do actually have available to us a system like this, which is like a handpiece that it oscillates the cannulas for you, but I don't use it. Maybe I will when I'm too old to hold a cannula, because that's what most older doctors are using, is something like this. Takes the work out of it. This is where you actually use water, I think, to break up the fat, and then you can remove it that way, similar to this. And these are not available in Australia, they're not TGA approved, but if you want to do large volume fat transfer, this is the way to go, because it breaks the fat up and extracts it, but it doesn't kill the cells. They're still living cells, so you can use it to put into the buttocks or the breast or the face.
So you don't have that here, it's not TGA?
No, we don't have it. No. This is the cryolipolysis, and you know the prices are coming down rapidly on this. When Zeltic came out, I think it was $70,000 for the practice to buy. Then for some reason they put the up to $200,000. They still sold a few machines, and now all the Chinese and the Germans and Danish people are coming in, so the price will go down. And I just saw that Australian Skin Clinics, which I used to be part of, has introduced that, but they're using a cheap machine. And it's like whenever you see promotional information, they're only going to show you the best photos. And when you look at the clinical trials, sometimes you can only see a bare minimal improvement, which is what they publish. But they never ask the patient one important question, which is, would you be happy with this result if you had to pay for it? And most of the time, I bet you the answer would be no. All right, it's improved, but not worth the money. When we transfer fat, we actually take great care to remove the fat cells with special instruments, and then we spin it down and we put additives into it. And so in the olden days, our success rate used to be 30 or 50%, but due to improvements nowadays, sometimes we keep 100% of the fat. So before we used to overcorrect and put more in than we needed because we knew that some of it would die away. Now we can not afford to do that because you might end up with too much. So fat transfer is great, except not in the lips, not around the eyes. Too risky and not good results, but we can do it everywhere else. So this is what the fat looks like when we've removed it. And look, and by the way, it's a great thing to think of, because rather than throw it away, we can store it and we can use it. And some people are even fat banking because you can get stem cells out of it. And so let's remove the fat and put it on ice when you're 30 or 40 years old. And when you're 70 or 80 and you might have cancer or you might have some need, you can defrost it, bring it back to life and get the stem cells out of it. So, and they're doing that with cord blood and all sorts of things. So, you know, but here's an example. And cheeks. This girl came to me, she'd had a facelift somewhere, was very unhappy with the lack of fullness, and I said, yeah, we can fix you, we can do fat transfer, and that's a long-term result. She burst into tears when I said we could help her. This lady, I did not do her eyelids, but I was very good friends with her husband, who even in his 70s was doing endurance horse riding. Anybody heard of that? It's like trail bike riding through the wilderness on horses. And that the skin improvement is from the fat transfer. Same with this lady, and this was...
Is that just the cheeks?
Cheeks and around, just the cheeks. A little bit in the temples. Can you see how she's hollowing in the temples? That's something that I pick up a lot, and a lot of other treating doctors and nurses don't pick up on it, but to me it's a very aging thing. And if you fill the temples, you lift the brow, and people look much better. This is Helen, and all these photos are many years ago. The techniques are even better now. Her husband just got an OBE about, when was the Queen's birthday list? June the Queen's birthday. He just passed away. prostate cancer. So she's been my patient for like donkey's years, 20 years plus. And that is about 10 litres worth of fat. And on the left is Sylvie, who's my French nurse, been working with me on and off donkey's years. On the right is Kerry, that used to work for me. Then she went to the meat clinic, but she's just left. Okay, so. And that's the happy ending. All right, so. Yeah, we'll just get you into uniform and then we can do that. Anyway, so look, that's a little presentation. I mean, we're just so lucky that we can live in an age where we can change our body and just look in the mirror and like what we see and not have to turn the light out, you know, when things happen. So thanks for listening to my droning, and help yourself to some more food and drinks, and I'm going to be available to have little chats with people, and then we'll follow it up with a longer consultation, you know, once things crystallise a little bit. Okay. And thank you, Francois, for hosting tonight, and to our wonderful staff for helping out. I do appreciate it. So thank you.